Spectrum Health is working to turn Grand Rapids into a hub for telerobotics. Doctors are pioneering research that could allow them to perform procedures with robots on patients thousands of miles away.
News 8's Kyle Mitchell shows us how the technology could be used to save lives and improve care in rural communities.
This is where Spectrum Health doctors are researching telerobotics, which would provide care to places that don't have access to specialists. The Corindus CorePath GRX is used on patients with Spectrum Health doctors nearby. This is the robotic arm that we use to do robotic coronary and neuro procedures. But researchers with the health system have shown it can be used up to 3,000 miles away. We're not yet doing these telerobotic procedures on humans, but we think that this research is going to get us one step closer to eventually being able to do that. Dr. Ryan Mader says rural areas often don't have specialists like him available to perform emergency procedures. They get actually inferior or outdated treatments because the technology or the expertise to do those more advanced kind of state-of-the-art treatments are not available in more rural locations. Using telerobotics could improve outcomes for patients who currently have heart attacks treated with medications and are often transferred to a bigger hospital. And in the setting of a heart attack, those transfer times, are associated with significant delays in getting the artery open, and that results in a higher risk of death. It results in a larger heart attack. Dr. Mader and his team announced a nearly $9 million three-year grant this week to continue funding the research. And one of the things that it's going to enable us to do is develop the first telerobotic connectivity between different hospital systems in different states. And so we'll be connecting a series of robotic controls here at Spectrum to 5 different hospitals out in the upper Midwest and west part of the United States. With the technology already proven to work on mannequins, the funding will allow the project to move forward. One of the things that the grant is going to allow us to do is actually to develop and build a training program which will allow us to bring physicians and hospital workers from other regions of the world to Grand Rapids to actually train and learn how to do robotics and telerobotics. In Grand Rapids, Kyle Mitchell, News 8.